Nós vamos começar com a apresentação do Jon Kofmarcher, do Erikson Institute. O Jon tem sido um companheiro muito presente, muito fiel nessa empreitada do Núcleo de Estudos da Violência, de desenvolver uma metodologia experimental de visitação com adolescentes. Ele é professor associado no Erikson Institute, e a pesquisa dele enfoca diferentes aspectos das respostas de crianças e de famílias aos programas de intervenção na primeira infância. O foco do interesse dele é na compreensão de por que as famílias participam desses programas, o que esta experiência significa para elas, e quais os tipos de serviço que têm o melhor desempenho para diferentes famílias sob diferentes circunstâncias. Ele também tem estudado a questão do treinamento e do desenvolvimento profissional das pessoas que são encarregadas de prover esses serviços para a primeira infância. Ele também é um professor associado do Her Research Center for Children and Social Policy e um Graduate Fellow do 0 to 3. Eu passo a palavra agora ao Jon. Você tem 30 minutos cravados.
Bom dia. I am so old I need glasses now. Thank you to Nev for organizing this conference and for inviting me. I want to let you know that some of my presentation uses slides from a presentation that I did in November 2009 in Porto Alegre. So there will be cases where the slides are translated into Portuguese. I'm sorry I ran out of time. I couldn't get the slides translated into Spanish. I was asked today to talk about supporting paraprofessionals in home visiting. But before we do that, I think we should define what we mean by paraprofessionals. And to do that, we need to define what we mean by professionals. What makes a professional? As I see it, there's four main features of a helper that lets us consider them to be professional. One is that they have a higher educational background, such as a degree from a college or a university. And with that degree usually comes some kind of specific training in their field. Although, as Mark pointed out yesterday, no one really gets taught in their formal schooling about how to be a home visitor, at least in the United States. PIM actually might be an exception. The professional has a history of experience in their field, of doing the work while being closely monitored and supervised. And all of this leads to some kind of license or certification or formal recognition of their qualifications. Now, the line between professional and paraprofessional is not always clear, and it's important to acknowledge this. My work on a study that looked at the role of community-based doulas helped me to understand this. Doulas are women who come from Doulas are women who help other women in the birth of their child, not as medical professionals, but as a helper who is concerned about the emotional well-being of the mother and her physical comfort. So their primary job is helping during labor delivery, but they also will work with the mother while she is pregnant to plan what she wants her birth to be, and they might also work with mothers after birth to help them with the transition to being a new parent. The doulas in the program that I worked with came from the same community as the poor young mothers they worked with. Most of them did not have a college degree, and they did not have previous experience doing this sort of work. So in many ways, they were paraprofessionals. But on the other hand, They did receive very intensive, specialized, hands-on training in being a doula, the equivalent of a month of full-time training for which they were paid. They also sought out additional trainings that led to their certification for things such as being a breastfeeding counselor. They were also employed by a university hospital, and they were given white coats to wear like the medical staff. So, are they professionals or are they not? The line's not always clear. And I will use examples from doulas that suggest that they went back and forth and how they viewed themselves as too. So why do we use paraprofessionals? Well, I think one of the primary reasons that we don't like to talk about as much is that you don't have to pay them as much. So a program can have more visitors for less money. In the United States, you might be able to hire 4 paraprofessionals for the cost of 1 nurse. So it can be a significant difference. You might want to support the development of a workforce in a distressed area. So it is a form of empowerment to provide employment to women within their own community. And finally, because paraprofessionals share common experiences and culture with the families they serve, they might understand the families better, and the families are more likely to trust them and relate to them. There is what we sometimes call a decreased social distance between the paraprofessional and the family that might make it easier to form relationships with them. But there are also challenges to using paraprofessionals, things we must consider and find ways to deal with if we want to use them in this field. One of the challenges is, for a lack of a better word, that you could say that they lack or are still learning professionalism. That is, they might not yet understand the culture of professionals, and so certain tasks that lead to a smoothly running program might be harder for them. They may struggle with organization and time management if they've never had a full-time job before. They may struggle more with record keeping and making sure that all the forms are filled out correctly for each family. They may not know expectations for dress or personal appearance. If visitors who come from the same, and some visitors from lower income communities, if they're exposed to the same educational problems as those of the families they see, may also have trouble with their own literacy, with reading all the material that's now expected of them. Obviously, this is not true for all paraprofessionals, and certainly some professionals struggle with these issues as well, but this is something that has been noted in the field. Another issue to consider is that professionals are partly considered professionals because they have a certain level of knowledge and expertise that they have received from other education and training and supervised experience. There are areas where they might simply have more knowledge and understanding, such as mental health concerns, or specific health symptoms in the mother or the child, or case management, which allows them to go in deeper to help families. Paraprofessionals are less likely to have had formal training about these topics, so they may only know what has been given to them as part of their hiring into the program. So this is one simple example from one of the studies that has directly compared paraprofessionals and professionals using the same program model. Nurse-family partnership is a well-known home visiting model in the United States that uses nurses as visitors, but for one trial, one group of the mothers actually received paraprofessionals who were using the program model. And one of the many results that came from this trial was that nurses, compared to paraprofessionals, spent considerably more time dealing with health issues with the mother, especially prenatally, and spent much more time focused on parenting. And the reason for this is likely because the nurses had the training and background that led them to spend more time on physical health with the mothers and on basic caregiving concerns that the mothers had. It's also been argued that being a professional brings more respect, whether that professional actually knows anything more or not. So, one example, pediatricians in the United States receive very little training about child development, but surveys show that parents trust their child's doctor more than any other person when they have questions about their child's development. Because they are doctors, and doctors have a high status. Most societies have hierarchies that value some helpers over others. Some in the United States have argued that home visiting will be taken more seriously by policymakers if the people doing the home visiting have professional background, training, and degrees. Finally, one challenge in using paraprofessionals is the way that they form relationships with the families. Now, this might seem ironic given that the prime motivation for hiring paraprofessionals is because they are seen as somebody who understands the families better and are more likely to be trusted by the families. But there are challenges to this decreased social distance, as I will talk about. The question is not, are home visitors worse at forming relationships with families than professionals? I don't think that's true at all. I don't think they are worse. But I do believe they approach relationships with families differently, and we need to pay attention to those differences. There are two parts of the home visitor that is important. There is what they do and who they are. I've talked a little bit about what home visitors do. In most programs, they teach parents about their child's development. They do activities and games, or teach the parents these activities and games. They help parents problem solve about aspects of their life. But equally important is not just what you do, but how you do it. In other words, what is it like for the home visitor to spend time with the parent? What is the relationship like between the parent and the home visitor? So how you are is just as important as what you do. There was a study of a home visiting program for high-risk mothers in the United States where the mothers were asked what was the most important thing that a home visitor did to help them. And the strongest answer, the one that they ranked the top, was that the home visitor was someone to talk to who really cared. This is one Spanish slide. This is what I mean when I say that the relationship is important. But what does it mean to really care? It means different things to different home visitors. I want to give you some examples through interviews that I did with home visitors in different early childhood programs. The first was a home visiting program for adolescent mothers that was run through Chicago high schools. The home visitors were paraprofessional. They did not have formal training in providing help, but they came from the same community as the mothers. They were to help the mothers stay in school, not get pregnant again, and to promote the child's development. The second program was also for young mothers, but they used doulas, who I noted before are trained birth helpers. They were hospital employees. They did have some formal training in how to help the mothers, but they also had similar backgrounds to the young mothers they helped. And third, I interviewed therapists at a mental health center that focused on working with families with young children. The therapists were mostly social workers. Most of the families they saw were referred because of concerns about the child's or the mother's mental health. The therapists did home visits, but they also saw the families at their office. So here is a typical quote from a paraprofessional about her relationship with a family. Notice that she's focused on feeling comfortable and happy when she thinks about having a good relationship with the mother. I won't read this slide. Okay? Here is a long quote from a mental health therapist. This is a psychologist who had many years of formal training in conducting therapy with families. Notice that she's focusing on very small or subtle signs that the client feels safe and is not defensive. She's paying attention to body language, and she's looking for small signs of trust. The mother's rolling of the eyes, the fact that the mother is not talking about not coming back anymore. She's looking for these small signs of trust. And here is a quote from a doula. Notice that she's also focusing on signs that the young mother trusts her to be helpful. The signs that the mother is actually seeking her out for help and advice. She says, "Now I believe the trust is going." Okay? One of the big differences between professionals and paraprofessionals is the willingness of the paraprofessional to put themselves personally into the relationship. Their helping relationship often has a more familiar and intense flavor than the professionals. They're more willing to share details of their private life, such as talking about their own past, sharing stories about their own children. They want to be seen as members of the family, such as a big sister or a second mother. They talk about feeling comfortable with the mother. That is a sign of a positive relationship when they feel comfortable with them. They are also willing to say that they love the mother, and they feel touched when a mother loves them back. These two quotes, I think, highlight these differences about where the personal fits into the helping relationship. The doula is saying that the mother will not talk about herself if you don't talk about yourself. These doulas tried very hard to be seen as different from other professionals who often did not respect these teenage mothers. The notion of respect was a powerful one. And by reaching out to the mothers this way, by letting them know, I'm a lot like you, they felt the mothers, they were seen as differently. They were seen differently by these mothers, and the mothers respected what they had to say. But the therapist, meanwhile, says that if you talk about yourself, then you're taking attention away from the client. Yes. Oh. In another example, a therapist complains that the client wants to view her as a friend, as a way of avoiding talking about really important things. So being seen as a friend is a bad thing. The therapist sees this as a problem with the relationships. Although therapists would talk about whether or not they liked a client, they did not see this as important to their job. Yeah, the training has taught them to be suspicious of relationships that get too friendly. One of the big differences between professionals and love is frequently mentioned in the interviews with the doulas and the paraprofessionals, and it is one thing that you see as different, as I noted before. But this is something you don't normally hear talk of love coming from the mouths of doctors or nurses or social workers or psychologists. They rarely talk about loving their clients. But you read these quotes where the doula and the mother are talking about each other, and it's very touching. The concerns of early childhood are intimate concerns. Going